awesome. And you're live.
It's official.
It's official. We're live.
We're live.
Hi.
Yay! You are alive.
You're alive.
Yay.
Happy Friday.
Happy Friday. Good morning. We're
My
having
deal.
our daily cup of coffee /
Water.
wine.
No, stop it.
We don't drink that
No.
early.
Mm-mm.
No, it's true.
H2O.
All the way. Or coffee.
I'm Dr. Ash, my Ideal Motion Chiropractic.
Sarah Johnson over here at Ideal Motion Chiropractic in Bonnet Lake, Washington, living it up live this morning. We wanted to give you guys a little bit more information about us and why we got into the industry that we did, why Dr. Ashley decided to become a chiropractic, and I decided to become
Be
a
a-
chiropractor.
Yeah, you're a chiropractor
Okay,
too?
no. Mm-mm. No, morning coffee. Hold on.
Yeah.
Before,
orthopedic massage therapist.
That's what I do. That's right.
Yep.
Mm.
I got your back, girl.
Thanks, lady.
Yeah, you're welcome.
That's what I love about you. You have so many people's back. It's amazing.
I do.
So why did you choose to have so many people's back?
Oh, I get to go first?
You do.
Oh my
We
goodness.
save,
Oh, you're
save the
so-
best for last.
Okay. I love you.
I love you too.
So I became a chiropractor. I always, since I was like a little girl, I always wanted to be a doctor. I told my parents that from day one, that I could speak and communicate and use Band-Aids, put them on my dad. But honestly, I always thought I'd be a pediatric surgeon or a pediatrician. I always wanted to kind of grow up and do that. And then certain things happened throughout my life and sports injuries. And then I was in a car accident after my freshman year of college when I was up here visiting, or well, going to summer school and working for my cousin who was a chiropractor. And after that car accident, I got chiropractic care, and I had never seen a chiropractor before and or knew what a chiropractor did. And within
That's brave.
I know, right?
Wow.
Yeah.
My goodness.
So, and I mean, I had never even done physical therapy prior to that, even with my sports injuries. So, it's totally foreign to me, and I got chiropractic care within 2 weeks after a decent accident. I was feeling significantly better, and I was like, wow, this is so amazing. You get to help people. It's non-invasive. It's not scary. It's drug-free. It was totally foreign to the idea, and anyway, long story short, I just absolutely love the profession, and I'm so grateful that I chose this profession, and yeah, every day is amazing. So
Yeah, it is. That's fantastic.
So
Yeah, and once you meet this lady, you realize that she really could do anything that she wanted to do with her life.
thank you.
She is just incredible, and I've absolutely loved working with her. More than I've loved working with anyone else in my entire career. Yeah, that's true. I love you too.
I love you.
And
So Sarah, why did you become a clinical orthopedic massage therapist?
excellent question.
Thank you.
I was never like that kid. My mom actually thought I was going to become a maid because my room was always spotless and clean, and I was always cleaning up. So luckily, I shot a little higher than that with clinical orthopedic massage work. But I was always running and very active in my youth, and I ran over at the University of Texas in San Antonio and started studying kinesiology. And originally, I wanted to become a physical therapist. And I realized nobody likes a physical therapist. And nobody listens to you guys, which is unfortunate because you guys are awesome. I love working with physical therapists. And so I thought, why not try something that people actually like, which is massage. So I moved up to Chicago and got my master's in clinical orthopedic work from the Soma Institute there, where my internship was out of a hospital. It was awesome. I got to work with people who have cancer, who have AIDS, who are in the hospital and actually going in, and that's when I realized how important human touch is, especially for people who are not well. And I just had a gift, and that's where I more or less discovered it. And ultimately, I wanted to work with just athletes. When I got out of school, it was just all about working with the NFL and the NBA, which I did. And once I worked with them, I realized that they're beasts. And they're exhausting. They're exhausting to work with.
Yeah.
I love working with them, but man, I got one and done. And that wasn't really good for a payday. So working with the average person, the average human with any kind of injury or motor vehicle accident, or that's really where life begins. And
That's
you
awesome.
really get to help a lot more people that way. So
That's awesome.
yeah,
And you do have magic hands.
magic hands.
Seriously.
I know when people tell me to
Spirit fingers.
shake my moneymaker, I go, here you go, here you go, making it. Silly. silly things I do.
You are silly.
But that's us. We're very silly.
Yeah.
We want to wrap it up. We know you guys have work to do instead of watching us. So please.
TJIF.
Yep.
Yeah.
Absolutely. Have an amazing weekend. Please leave any comments or questions below. We'd love to answer them for you. We're going to get into a lot more. We're going to do this weekly, and we're going to get into a lot more complementary therapies, how to take care of yourself at home, nutrition, anything you want to hear us talk about, just comment below. All right, guys.
Awesome. Love you guys from Ideal Motion Chiropractic.
Yay. Have a great weekend.